Okay, so we are going to teach you about needles. Part of your skill of giving an IM injection is determining what size needle you will need and what size syringe, depending on how much quantity of medication. So we're going to talk about first the size of syringes. Remember, a syringe is different than a needle. Sometimes with your supplies, your syringe will become attached with your needle already, and sometimes separately you will have your syringe and need to select a needle. So pay attention when you are looking at your supplies. You are seeing what your equipment is included in that supply, and you're also looking at what size needle is attached to that syringe. We're going to talk about different sizes of needles. First of all is deciding which site you are going to inject in. Now, different sites require different sizes of needles, as do different types of injections require different sizes of needles. And we're going to talk about that a little bit. We'll demonstrate those for you. So, needle sizes come in gauges. They start at about 15, 16 gauge and go all the way up to 25 gauge. The thing to remember here is the larger the number, the smaller the size. So a 15, 16 gauge needle will be very large, where a 25 gauge needle will be very small and thin. The other thing we need to look for is the length of the needle. Depending on what site and what type of injection we give, we need to determine whether we need a 5/8 inch or up to a 1.5 inch. And those are all listed on your wrapper of your needle. Okay, so all that selection is done before we actually administer and we decide what site we're going to use. So another thing is the size of syringes. Okay, so we have anywhere from a 1 milliliter syringe up to 10 milliliter syringes that we can choose for injections. So I'm going to demonstrate and show you a few of these different types of syringes. We have just a 1 milliliter syringe. I'm going to open this and show you. You can see that the increments start at 0.1 milliliters and go all the way up to 1 milliliter. Okay, also pay attention to the type of tip that's on your syringe. Syringes will include different types of tips. This is just a regular as opposed to a Luer Lock, and I will show you that on another type of syringe. Okay, so that's a 1 milliliter. Remember when you open these syringe packages that the end of that syringe is sterile. This whole thing is sterile. So we need to be very careful not to contaminate the tip of that syringe. We don't ever want to lay it down on a table, for instance. We want to attach that right to a needle. If we're not going to attach it right away, be very careful to slip it right back in its package so we can keep that as clean as possible. Now we can go up to a 3 milliliter syringe. This syringe, you can see those 0.1, 0.2s are not visible. Okay, you will see a 0.5 milliliter, a 1 milliliter. These go by 0.5 or half milliliter increments. You can still measure by these smaller increments in between a smaller dose, but we need to be very careful. If I'm giving 0.6 milliliters of fluid, I don't want to choose this syringe. I may want to choose a smaller syringe so I can make sure and get that exact dose. Okay, and we go up all the way to 3 milliliters. Now see how the end of this is different. It's got kind of a screw looking type tip. That is called a Luer Lock. Many syringes or needles are made to interlock and tighten on there so that needle doesn't come off. That's called a Luer Lock. We go up to a 5 milliliter syringe. Again, those increments just keep getting a little smaller on those lines, so you need to pay attention and select the right size of syringe, all the way up to a 10. Okay, so these are the types of syringes we will typically use for injections. Other skills, which we will show you, will use larger syringes, but these are typical for injections. Now, those are for giving medication. One medication specifically dictates a different type of syringe, and that is insulin. Okay, insulin has its own syringe. And if you look closely at this, the insulin is not measured in milliliters, it is measured in units. So we can see here that this is 10 units, 15 units, 20 units. This is not the same as milliliters. You can only draw up and administer insulin in an insulin syringe.